is the skill of atrium chest tube transport at the moment. So we'll just quickly touch on the indications. We've got our mannequin set up here, or our real life patient in ambulance, wherever it will be. So it's just for the definitive management of a pneumothorax following needle decompression, predominantly, or finger thoracostomy more so than needle decompression, but used routinely in hospitals for that also. So you might typically see these patients on transfers as opposed to you pre-hospitally putting them in. So it's important to go through your initial patient assessment. So you want to continually monitor your heart rate, blood pressure, respiratory rate, ventilation. Are they self-ventilating or are they under manual ventilation via machine? And with that comes your SpO2. So you really want to keep a focus on your breathing assessment, auscultate each side of the chest quite frequently, any changes with regards to that. Our patient comes in with suffocating emphysema just in case. And basically you just want to be really hyper-vigilant on your airway assessment. So if we go down to the actual device itself that we've set up, might seem a little bit different to this one, but typically they're kept lower than the patient's body, lower than the chest height, working on a negative pressure vacuum suction there. So if we're looking directly at the insertion of the fifth intercostal of a chest tube transport, straight into the underwater, I think they call them underwater
seal drains.
Underwater seal drains, there you go. So as you see on the skill sheet that we've created, this is what they look like. Bear in mind there's a high risk of bodily fluid, PPE must be recorded, everything like that, gloves, gowns, glasses, everything, sterile procedure. So you want to assure that the suction device is working when it's implemented, appropriate connection to the patient, and then you want to see oscillation of the lung may increase when it's fully expanded. So moving on, go down our skill sheet. Like I said before, when it's at the adequate level, you might get an indicator on your chest tube device, suction device transport that you're using, a little tick, a little cross, things like that. Generally, suction's normally set to, I think it's minus 20 centimetres of water for patients, and you'll see bubbling or marks or indications depending on the device you're using. In something like this, you would see a bubbling of their ventilation based on that chest drain. And this just shows an adequate watertight seal, the air's getting through there. So you might see increased bubbling on coughing, forced inhalation, forced breaths, any respiratory distress, or if there's a huge amount of bubbling, just check for leaks, recheck your equipment, go back and troubleshoot there. So it's quite a lot of fluid, each one's dependent on which and how much fluid will be in the device. Best to check with the practitioner on scene if you're taking over care of the device, and document that on your piece of paper, on your PCR for blood loss, fluid loss, anything like that. So bear in mind with transport, like I said, keeping it below, keeping an eye on it, you want to make sure there's no leaks. Typically you might see patients like this in vacuum mattresses and things like that. Just keep the area sterile, open, easy access, and bear in mind, in a positive pressure ventilation patient, you might not, in RSI, you might not have need for this, but just think about pain management, ongoing pain management, and just consistent reassessment with regards to it. Obviously troubleshooting, you want to aim for that minus 20 on your suction device in order to adequately have a chest tube drain. So I suppose we'll touch on the disadvantages. Any tube blockages, make sure there's no occlusions, blocking, kinking, leaks in the tube itself. Otherwise you're not going to get an adequate seal. So that involves in tube misplacement. It is an open body wound directly into the space, so just bear in mind transport aseptic techniques. You don't want to cause a body infection to the patient. And yeah, like I said before, just look for air leaks. Constantly look at your device and call for someone if you need help.